hear. Now, I've done my little breakdown
Yeah.
on knee osteoarthritis, but please tell us, what exactly is knee osteoarthritis?
Well, I mean, you took most of the words, so but very, very, very simple term, it will be when the joint has a, when the tissue is too flexible, so there's a wear and tear onto the cartilage. So, I mean, once the cartilage starts to rub off, and it is a type of arthritis. So, like I said, it's a wear and tear focusing on the knee. So yeah, and it causes a lot of inflammation when that happens, especially when you are heavy, when you're upper weight, when you have a little bit of weight of upper, it compresses into the knee, and especially when you age more and more and more, this becomes very difficult for the person or the patient to move faster. So yeah.
Okay, now there are different stages of osteoarthritis.
Yeah.
I hear there are 4 stages. So can you give us a little bit of information on that?
Okay, so we have stage A.
Okay.
Stage A is like stage 0, which is a normal knee. Then we have the stage 1. That is saying that the space between the joint is less than 50%. That's less than 50%. So the joint is less than 50%. Stage 2 is more than 50%.
Okay.
So the space joint is more than 50%.
When you say the space joint, what does that mean?
So the formation of the knee, there are kind of little gaps in between those little spaces. So that
Okay.
is measured.
Okay.
So that's why the stage 1, it says less than 50%. And then the stage 2 is more than 50%.
Less than 50% of the space is left, or is...
So the joint itself is supposed to have a little bit, some sort of little space, so which is the like a smooth groove onto it. So when the spacing opens up a little bit or it decreases.
Okay. So when it opens up, then it becomes more than 50%, and when it reduces, it becomes less than 50%. Okay.
Then stage 3 is when there's a loss of the cartilage. That's stage 3.
Okay.
Stage 4 is the destruction of the cartilage tissue, and so on and so on. So that is like the worst stage, and sometimes when you get an x-ray, sometimes you see some sort of wear and tear on the cartilage, just like a chicken bone. When you break the wing, that white stuff starts to rub off, and sometimes starts to rub off onto the bone. So the bone has this little circles or spots, or that's breaking into the bone. So it causes this, sometimes this internal bleeding. Sometimes you hear patients that when they move a certain, maybe for example, they can't extend their leg fully. So when you ask them to extend it, they start to say, oh no, there's a sharp pain, or they feel some sort of needle into their joint. Or sometimes, worst case scenario, you see that there's this kind of a blood clot, like a stain onto the skin, onto the bone.